have two, can have one, two, or three roots, depending on their types and location within the mouth. At the end of each root, it, it has small open space called the apical foramen, which allows the entry of nerves and blood vessels inside the tooth. The enamel is the hard outer layer that covers the crown. He has considered the hardest tissue in the body as it is able to withstand the pressure of chewing. However, it's also very fragile and can break very easily. The enamel is transparent because the color of the tooth provides the dentin, which is below it. Dentin is a bone-like substance that forms the bulk of the tooth structure that lies beneath the enamel on the tooth crown and below the cement into the root area. Is the tissue responsible for the color of the tooth? It can change color, too much coffee, tea, or snuff, excessive use of tetracycline, fluoride, or certain diseases or age. Another part of the teeth is the cement, a layer covering the root tissue is less white, hard enamel. In the cement is inserted fibers that hold the tooth in the bone. The pulp or pulp chamber is the center of the tooth, which houses the blood vessels, nerves, and connective tissue. Blood flow in the pulp provides nutrients that help maintain the vitality of the tooth. The pulp canal or root canal is the open space in the center of the root, where are located the blood vessels and nerves enter the tooth pulp form. If the pulp becomes inflamed, infected, or is no longer able to nourish the tooth, will require treatment of the canal to save the tooth, which otherwise might be lost. Finally, there is the apical foramen, a small opening at the tip of each root, through which penetrate the tooth nerves and blood vessels. The teeth are coated with a special glaze that protects them from any external aggression. When this layer is disappearing gradually, softening its leaves to protect them and allow germs in the mouth they attack. Given the decay is no timely care can result in total destruction and loss of the tooth. It is believed that tooth decay is the most common infectious disease in children and its effects can cause problems in growth and development. They come in white spots such as deposit or flake or tartar brown or black spot and may cause small cracks or cavities. Cavities are caused by a bacterium called Streptococcus mutans, which is transmitted through saliva, especially the mother. The bacteria are concentrated in the form of flakes on the smooth surface of the teeth and are activated when fermentable carbohydrates such as sugar and do produce acid. The acid formed by bacteria attacks the tooth surface, destroying the enamel to deteriorate so that it's causing destruction to penetrate inside. It is manifested by severe pain when the cavity after passing through the pulp reaches the nerves. This process begins shortly after lunch and continues for at least 20 minutes and can be stopped by removing food debris, brushing, and flossing. The loss of teeth and teeth bother diverse as difficulty chewing and digestive problems. Through articulating words well, for the gaps left, cause movement and diversion of other teeth, gums, and wear of self-esteem issues, among other problems. A cavity can be detected or seen by going to the dentist at least once a year for an overall with X-rays and teeth cleaning. Often it is easier to detect decay for oneself, which requires a thorough review. When you feel a sore tooth and not see decay, if you see black dots or pits on teeth and molars, if the cheek is swollen and for no apparent reason, when there's difficulty eating and chewing food, when you feel pain or discomfort when taking hot or cold liquids, when there is bad breath and feel an unpleasant taste, it is important to know that sometimes a toothache may disappear alone. This is because the nerve fibers found in the pulp eventually die. But the infection is still there, and if left untreated, the problem may